Welcome to Vital Signs. I am your host, Jen Gaudet, sharing what's real and relevant in healthcare, wellness, and peak human performance, empowering people to take control and advocate for their greatest asset, your health. Remember, this show is for educational purposes only. It's not meant to be taken as medical advice. Always seek out your medical practitioner advice before changing your healthcare routines. Well, I'm really excited to bring back a couple of our guests who have been here before, and we are going to talk all things detox. I know we've been hot on that topic in the past. It's a hot topic now. I see your questions. So let's welcome back to the studio, Christian Elliot and Heather Gessling, partners in Healing United. Welcome back to the show.
Thanks, Jen.
Thanks, Jen. It's great to be here.
So talk to me a little bit about how Detox your philosophy behind it. Where did that come from? And what do we as consumers need to know with regards to detoxification?
Yeah, I guess really where we started was just recognizing that there's two main paradigms competing for people's attention. There's a treatment paradigm that says there's something malfunctioning in your body and we need to force it to do something differently. And there's a healing paradigm that says your body knows how to heal, but it's our job to figure out what's in the way of healing, to remove the burden and to empower it to function. And so really it's turning the model of treatment on its head and saying, that's not going to get it done. We can't endlessly play biochemical whack-a-mole and expect that we are going to somehow get people back to health. We have to accept and work with the innate intelligence of the body that it can heal itself. So it's a philosophical starting point that we build on.
Yeah, and not only do we not want to be playing biochemical whack-a-mole, but we don't want to be adding toxic burden when we're trying to help somebody with their chronic medical conditions. And so when we add in the typical mainstream pharmaceutical type solutions, we're just adding on burden for their body to have to detoxify.
And so as we talk about this, I mean, toxicity is everywhere. It's in the air that we breathe. It's in our water. It's in our food sources. We cannot completely avoid this. And our bodies are kind of innately made to detoxify at some level. But can you kind of talk to us a little bit deeper about how do you approach detoxification from that holistic perspective so that we're not adding toxic load to what we're already exposed to in our everyday environment?
Yeah, I'd start with a place. There's obviously there's environmental toxicity and there's food, air, and water. But so I'll go to an outlier thing first, and it's the recognition that we also can poison ourselves with our thoughts. And sometimes our toxic thinking is where we have the biggest upstream logjam that is preventing healing. And it's the frame that says my body can't heal, or I don't know if this is possible, or who am I to try, or I don't know if I'm worth the effort, or any number of the self-defeating, self-image thoughts that tend to short circuit your will to try, or an anxious loop you get stuck in where worry becomes your constant companion. Those kinds of things are so highly toxic, and they're often missed when it comes to the healing journey. So part of the work we do, we definitely go after chemical toxicity, but we also recognize that as a whole person, we need to step back and understand the storytelling you have going on in your world and how you're framing your healing journey, because that might keep you from healing no matter what other modality we throw at you.
Yeah, and so on the flip side of that, not only do we not want to be having the negative thoughts, we want to be having the positive thoughts and telling your body, hey, take care of this problem. Hey, clear out these toxins. It can actually be beneficial just to have those thoughts and to think what I'm doing is going to help me, or what I'm going to focus on is going to help me.
Okay, so I'm going to go a little bit deeper because I'm hearing this and I'm totally on board. I agree with you in stopping the stinking thinking, because all it does is it elevates our stress and makes it harder. But it's not quite so easy in practice. So for everybody who's listening and you're like, oh yes, I'm feeling this. I'm the one in my head. I've got all the reasons why I can't heal myself, why I can't do the things that are healthy for me. How do we interrupt that? Talk to me a little bit about an actionable item that our listeners today can just pattern interrupt and flip to that positive thoughts. Do you have something that people can just start to do? Because the other side of it is when we start to get aware of it, then we beat ourselves up even more because we're like, oh my goodness, they're stinking thinking. And then we get into that loop. So how do we break the loop so we can start that positivity?
Fantastic. That's totally my sweet spot of what I do a lot with people. So recognizing that when you're framing your possibility, what you're doing is you're telling yourself an outcome. You're telling yourself a story. And in storytelling, we often get some gaps wrong. And so one of the easiest ways to identify where your thinking is stuck is to say, do I have any absolute binary statements? Do I have any words like can't, don't, always, never, all of the time, everyone else, it is, and we just use it as a fixed reality. When if we had to go defend that reality in court, we wouldn't be able to bulletproof defend it because, okay, it's not true that all of the time, and I never can do that. And part of the way out of it is one, identifying the words, but then two, using different ones that are actually more accurate. Like historically, I've had a tendency to, and in the past, I've had a hard time with, and I don't know if this is possible, but I'm willing to try. And it's those it's those subtle shifts in how we talk to ourselves that open up the door that healing is possible. And sometimes we just need a frame of reference that says it is possible. And I just had to walk through the door of changing the way I think first with subtle shifts in language like that.
I absolutely love it. Talk to me a little bit about the role of some of the alternative therapies. Once we stop that stinking thinking, once we get that positive thought process, or we're moving to, like I presently struggle with, I'm working towards, once we get that language under control and how we're talking to ourselves and shifting that, what's the next role of some of these holistic therapies that you guys are doing with your detox program?
I think the main thing first is to keep it simple, and so that you start feeling better and you can see the benefits of your actions. So keep it simple, such as let's talk first about, what your water source is and is it filtered? Reduce some of the toxic products that you may be using every day, like fluoride and aluminum. Make sure your pathways are open. This is what Christian has taught me, and I love the philosophy of it. Make sure your detox pathways are open, such as frequent urination. Make sure you're not constipated. Make sure you're sweating and moving and you have lymphatic flow and blood flow. And then once you start noticing how those little changes can increase your energy and make you feel better, then you start getting into some more complex detox.
Yeah. And if you recognize that healing comes from your lifestyle, it doesn't come from the pills you swallow. We have this backwards approach that got to be something somewhere I haven't figured out how to swallow. And that's akin to asking the government to come up with a cure for crime. There's this one thing that if we do this thing, crime will magically go away. Or there's this one thing, if I swallow it, my body will heal. And it's not how it works. The body heals because the lifestyle is sturdy and solid. And the analogy we like to use is that if you're trying to build a boat and all you have is rotten wood, it won't make a difference how great the screws are. And the lifestyle is the wood, it's the food, it's the mindset, it's the exercise, it's the sleep habits, it's all the things that we all can't get away from that are beneficial. And the screws, the alternative therapies, the supplements, the adjunct things are the screws, and they can be highly effective if the lifestyle, if the wood is not rotten.
Mm-hmm. So build a foundation first before we add on. I couldn't agree more. And so talk to me a little bit about, I believe it was you, Heather, that said, make sure that our detox pathways are open, or maybe it was Christian. And you talked about frequency of urination, frequency of all the things like sweating, etc. What is how do we know? How do we know if we're normal? How do we know if our frequency is normal, or if we've got a blockage there? How do we know if our bowels are moving in an appropriate fashion? Like what are some things that we can notice if we're sitting here listening today and say, oh, wait, I got to get this moving a little bit faster?
Well, that's a great question, because this is a topic that comes up in my clinic all the time. When I ask patients, are you having daily bowel movements? And they're like, oh no, I've never had daily bowel movements. And I'm like, well, actually, that's the norm. And they're like, not for me. And I go, no, it can be for you. And so we get them on we have a different paradigm to think about what's normal. Just because they haven't had frequent bowel movements, or just because they, don't think that's possible for them, we let them know that we're going to get that. We're going to make sure that happens. And once or twice a day is what we want for that. Of course, we want lots of, and maybe more. 3 is was fine too. We want lots of urination during the day because that means they're staying hydrated and they're getting all of that ability for their kidneys to be filtering and detoxing. Everything's not just, sort of sludgy in there and not moving. And of course, when you sit in a sauna or when you move and exercise, you're going to be making sure that you're going to be getting lots of detoxing and excretion of toxins through sweat, which is great. And actually sauna and moving can secrete different toxins. If you look up sort of things that come out when you're sweating by exercising versus when you're sweating by sauna, or when you're crying because you're emotional, or when you're crying because something's in your eye, you're releasing different things with all of those different activities.
Anything to add, Christian? I thought that was fantastic.
No, I love her answer, and it really does. Like, the one thing I'll highlight is how important movement is. If you think of your pelvis and you recognize that walking, it's subtly doing this, and you picture your diaphragm, this balloon, that kind of your sac that your intestines sit in, and you're breathing and it's moving in 3 dimensions while your pelvis is moving. You're massaging, you're getting movement going through your whole skeleton, through your whole lymphatic system. But that's part of getting your bowels moving. If you're not pooping, we've got to get you moving. If you want to heal, we've got to get you sweating. Nothing exits your body without water. So we better have that in there, to Heather's point. And then once you just master the basics, okay, then now let's consider a detox. Now let's figure out what we can do in adjunct to accelerate it even more.
Fantastic. I love it. One of the first things they teach us in PT school is movement produces movement, especially for our post-op patients. And, that's the easiest way to get things moving. How can people reach out to you if they are listening today and they're like, wow, this is awesome. I'm stuck in stinking thinking I need a little help here, or I want to know what's next. How can they reach out to you?
They can just go to our website, healingunited.today. There's an option to schedule a consultation with us, just a little button on the top right of the screen. We also have a live detox workshop we host every 4 to 6 weeks where people can just come and learn. It's free. There's nothing to buy there. It's just our chance to teach you. And if you're interested in further help and mentorship, we can talk about it there. But those are really the 2 best ways to get a hold of us.
Thank you so much. Thank you guys for being here today. We do have to take a brief break, but we will be right back after these messages. Welcome back to Vital Signs. I'm Jen Gaudet. We are here with Christian and Heather talking about detox and other things before the break. But now we're going to shift gears a little bit and talk a little bit about some of the systemic issues we have in the healthcare industry that have led to a lot of the health problems that we see as almost epidemic here, especially in the United States. So I'm going to pose the question first and let you guys kind of frame, what are some of the systemic issues that you see in healthcare as we know it today, or that you've encountered, and let's kind of frame the problem.
Oof.
Well, you want me? I guess I can start, since I'm in healthcare and as a physician, trained in allopathic mainstream medicine, trained to treat disease. And so one of the biggest problems that I have seen over the last 4 years, longer, but particularly over the last 4 years, is that they have removed the individuality and autonomy of a physician's choice. And so if physicians want to be able to treat a patient a certain way, and it's sort of maybe outside of what's called evidence-based medicine or protocol or standard of care, that can really come down hard on a physician, and it can be used against them. And physicians are scared of doing that, especially if they're an employee, if they're part of a hospital, if they're part of a larger system. They just have no interest in potentially putting their license or their reputation or their job at risk. And so used to, physicians would think, and they would take a patient, analyze the data, analyze the history and physical, and be able to come up with a plan. They don't really do that like they should anymore. They actually hardly do that. They may decide on a diagnosis, and then they go to a protocol or a standard of care or evidence-based medicine and decide on treatment, which is typically or frequently not the best for the patient.
And honestly, actuarian model, it's treating to the 50 percentile, right? But we have outliers on both sides. We have people who are elite athletes, and actuarian model is not serving them. And we have people who are very, very ill, and they can't even get to the level where some people are, and we have biodiversity. So I completely understand where you're going with this. And so I guess the next question is, how do we shift the paradigm back towards, individualized care for the patient in front of us, so that we can start to move that and shift that problem towards solution?
Christian, do you have ideas?
I have so much to say about that. Yeah, if we don't understand the historical origin of the monopolistic underpinnings that birthed what we today call conventional medicine, then we will miss what we're actually dealing with. We have to understand our history. So part of the answer to your question is we have to educate the general public and break the trance that was established back in the early 1900s of what we today can call Rockefeller medicine, which the word allopathic literally means other suffering. You take the suffering someone has and you put a different suffering on top of it so they don't notice the original suffering they had. That's the model. And the model uses cut, burn, and poison as the three main treatments that are supposed to somehow birth health and bring us back to health. And the basic thing that conventional medicine doesn't have going for it is logic. That doesn't make any sense to try to poison the body back to health. Can there be some helpful interventions? Is conventional medicine great at trauma and emergency care? Yes. Does it stink at everything else? Pretty much, because it's operating from a treatment paradigm, not a healing paradigm. It's hubristic that says the body can't fight its own battles. We have to intervene. And to Heather's point, we have to have a standard of care, and doctors that break ranks not only risk getting reprimanded, they risk losing their license and their ability to put food on the table.
Yeah, and so we had talked earlier in a couple of earlier episodes about establishing the foundation of health. And the foundation of health is lifestyle and orientation. It's about sleep. It's about our nutrition, our fueling our body, our moving our body. It's about those lifestyle habits that set the ground for optimized health. But also, if we're in a disease process, that's going to help restore that underlying foundation of health so that we can actually heal. So can you give me some insights or share some insights with our viewers and our listeners? Like, what are some of the ways that they can advocate for this more equitable healthcare system, like a healthcare system that's truly getting us back to peak health and vitality, as opposed to managing a disease?
Yeah, I would love to speak to that. So one of the things that I think we must do, what patients must do, is reclaim their autonomy, reclaim their ability to take back their health. They handed it over decades ago. Most of society has handed over their health to their doctor, trusted everything that their doctor or their healthcare provider says, and not question, and also even maybe feel guilty or like they've done something wrong if they don't do everything their doctor says. They're not going to get better if they don't do what's right for them. And so all of the things that we have discussed in other episodes about, the foundation of good health, it must start with a patient reclaiming their ability to make the decisions for themselves.
And so I'm going to go a step further, because you're a physician, and I know this is true. I mean, I'm a physical therapist by trade, and they were even nervous coming to me until we built that rapport over time. But how do we advocate for ourselves because a lot of people who are watching, listening, a lot of patients are nervous about bringing questions to doctors. They're nervous about questioning, well, I don't know about this medication, or I'm on 15 medications. What's going to happen if I add another one? So how do we break that ice as the patient if we're a little apprehensive about advocating for ourselves and our choices and our health?
Well, I would say that the patient, first of all, needs to feel comfortable speaking up for themselves. And there's tricks. I mean, you don't have to be adversarial. You can try and be as diplomatic as possible. You can expect the best out of your physician. You may not get it. They may not be responsive, and you may have to find a different physician. You may have to look until you do find one. I'm a direct primary care physician, and I can say with certainty that most direct primary care physicians are going to give you more time and listen than somebody that's in the insurance model. A DPC physician is going to have freedom to be able to go outside of the mainstream protocols and treat you in a different way and listen to your concerns. You may be able to find a physician that is open-minded in the insurance model. It's just going to be rare, and I wouldn't expect it.
Christian, you've been really quiet on this, and I know you're on the coaching side. So I know this is
Yes.
something from how do I get the guts? Is it writing it down and bringing it if I can't use my actual voice? Like, what is that step that we as patients can take if we're hearing this and we're going, oh my gosh, I'm really nervous,
Yeah.
especially, I'm going to say, especially with women's health and men's health. Those are very uncomfortable topics for people to discuss in general, let alone with their doctors.
Yeah, I guess I'd say two things. The first would be almost playing dumb. So if you can ask your doctor for the package insert on any particular medication or thing you're supposed to put inside your body, and ask them to read through the side effects, read through the trial that was tested, and then ask them, "Hey, can you explain to me, how do we know that my body wouldn't experience these symptoms? How do we know that this test that was done on this random group of men that were college age applies to me?" And when you start asking questions, you can do it, to Heather's point, in a non-combative way. And you do it in a way that it puts the doctor in a position of needing to explain and justify the therapy, which is often where they have a hard time. And you're not doing that to be mean. You're doing that to genuinely realize that your question was penetrating. Your question had wisdom behind it, and it wasn't silly, and it gives you a little more confidence. The other thing I'd say is sometimes you just need to break up with the system. Sometimes we reform it by not using it. And we find other practitioners of different ilk who are healers and who are teachers, who are not treaters, people that actually go to work and find the roots of the problem and help you build a lifestyle and find the interventions that can be the nudge you need to really accelerate healing.
I think that's fantastic advice. So if you're listening at home, the number one thing that we can do is advocate for ourselves. And that I love the idea of acting dumb, even if we've done our research, asking, well, what about this side effect? I'm really concerned about this. And what is the likelihood? I think that's a really less threatening way for us to ask questions. So what I want to just summarize, because I think this is a very important topic, is the way we impact change, the way we impact change in the system is for us to advocate for our greatest asset, our health. And by doing that, that's opening up our mouths, that's asking the questions in our physicians, that's having them answer our questions. And then if we are not comfortable with a treatment plan, getting a second opinion to make sure that we can set ourselves for success. We are drawing towards the end of our segment, but how else can patients and practitioners advocate for change in the system? Is there any last quick tips that you ladies and gentlemen have that they can take to heart and start today?
Plenty. Yes. I guess the biggest one would be to take your own health seriously, to realize nobody else is responsible to manage your health but you. And if you're in the position where you think, I just need to wait for someone else to tell me what to do, you will probably always have the health that reflects that you're waiting for someone else to tell you what to do. So take ownership of it, because nobody else can manage it and they can't practice your good habits for you. You have to do it. That's really how we start to really not need the system, and we can fall back on it for what it's really good at, which is trauma and emergency care.
I love that answer. That's good. It's good at trauma and emergency care.
Fantastic. Thank you once again for your expertise. Thank you for shedding some light on this. We've actually talked about this topic quite a bit off and on over the last several weeks because we need to have a change. We know that we're the least healthy that we've ever been. And today's the day that each and every one of you advocates for your health, for your vitality, so that you can get back to health or get to peak performance. If you would like to reach out to Christian or Heather, how can they reach out to you?
They can send us an email. They can go to support@healingunited.today, or you can just go to that website, healingunited.today. And we have a free workshop we offer on detoxification. And you could just schedule your own 45-minute consultation to talk to us, and we'll see what we can do to help you.
Thank you guys so much for being here again today. We do have to take a brief break. Reach out to these professionals. They are experts in the space. They've been here before. You've heard them multiple times. If you have any further questions, do reach out to Heather and Christian. We will be right back after these messages. Welcome back to Vital Signs. If you're just tuning in, you're going to want to go to nowmedia.tv, click on shows, and go to Vital Signs to catch the beginning of the show. It has been pure gold. And I want to remind you, as always, this show is for educational purposes only. Always consult your medical practitioners before making any changes to your healthcare protocols. Without further ado, we are going to shift gears a little bit and move into the hydration space. Why? Because one of the most essential aspects of our health and well-being is hydration. And we've talked about it a little bit before, but I have brought an expert in the space who takes it to a whole other level. I'm really excited to introduce to you Chelsea Jubilee. She is really a powerhouse, and she has got hydration down to the cellular level. Welcome to the show, Chelsea.
Thank you, Jen. Thanks so much for having me. I'm excited to share today.
So Chelsea, Energize Health, you're really passionate about this. You're moving and shaking, and you're really moving people towards a different kind of hydration. We think about hydration as just drink water, whatever the normal everyday thing is, but you're talking about hydration on a cellular level. Can you shed some light on what that means and how is that different than what we've heard before?
Yeah, absolutely. So yes, we refer to it as intracellular hydration is the scientific term, but that really is hydration inside of a cell. So most of the time, our biggest passion is to share what we consider the number one health metric that everyone should know about their body, which is how hydrated are you? Your body should actually mostly be water. We work with thousands of patients across, the country, and most of them are very dehydrated. When we take their hydration levels, they're super dehydrated. And the number one thing we get is, well, I drink a bunch of water, so why am I not hydrated? But there is a very big difference, because when you consume water, that is when it goes into the body, that's considered extracellular hydration, which is water on the outside of the cell. But our science, what we love to do is we love to share with people that there's a way to actually push that into the cell, make it porous like a sponge so it actually uptakes that hydration and lets toxins out of the cell. It kind of works like a filtration system, if you will, for the cells. So intracellular water and intracellular hydration is really that number one metric that we want all people just to become educated about with their health. And there's a simple way. You just hop on a bioimpedance device to find out how to figure out how hydrated you actually are.
And so you're absolutely right. We are designed to be made up mostly of water. And as we think about this, if we get on a bioimpedance and we discover, oh wow, I'm only 33% hydrated or 42% hydrated. Like, how do we take that and change that? What are the things that we need to think about differently, or how do we need to change how we've been addressing hydration once we get that baseline and go, holy cow, like I'm in that demographic, perimenopausal women are some of the most dehydrated people on the planet. So how do I shift that for my health?
Yeah, so there's a number of different methods that, part of our protocol is we walk people through simple steps, and I'll actually share a few here today on the show. So one of the biggest things we've heard for a long time is get sodium out, right? So this became a trend over the last few decades. Don't consume sodium, lower your sodium levels. Well, sodium is a natural occurring electrolyte. It is absolutely necessary to actually consume sodium. We love to tell people to put it in their water when they drink their water. It's a natural electrolyte. It's one of the only nutrients to the brain. And we could talk about, how to up and become a peak performer with your brain because of hydration a little bit later in the show. But consuming sodium is super, super important. We like to tell people to put a little bit, like a few dashes of salt in their water as they're drinking it throughout the day.
Wow. And that's completely different than what is out there in traditional media, right? You don't want to have that. So you're literally shifting the way that we think about how we consume even our water during the day. So I'm going to ask you, how do we make that taste good? Because salt water, I don't know about that.
Well, surprisingly, we're not saying, hey, dump like a bunch of salt in the water, but just, a few sprinkles. Like we like to tell people morning and evening. So your morning and evening water that you have, like just put a little bit of salt, even some pinches of salt, but you would be so surprised at even just what that does. Salt is a natural, like I said, it's a natural occurring electrolyte, but absolutely, especially if it's paired with something like potassium, it's just a powerhouse at getting hydration into the cells. So a lot of even supplements that people consume, nutrition that they're eating, even the water that they're drinking, when your cells are really hard like a marble, and a lot of things actually can cause the cellular wall of the cell to actually become, that membrane to become really hard, like we call it a marble. And when you're trying to pour water over marbles or on a glass countertop, not a lot of it's going to get in, but that's the same for supplements you're taking or food that you're eating. And so you really have to know like the sequence and steps of what it takes to open that cellular wall up. And that's a lot about the science that we teach. We have a patent pending on our sequence right now. But one of the things that we give clients just to do is to start drinking small amounts of salt water, and they're amazed at what it does for them in a very short amount of time. And again, we're not talking a ton of salt. Like I'm talking about just a dash or two. Even on your food, it is a big noticeable difference, and your body needs it.
Absolutely. And I mean, I just think about, I come from medicine. So the sodium, potassium pump in your heart, like there's so many of your body systems that require these electrolytes as well. So let me ask you the next question. Once we achieve that intracellular hydration, what's the impact on our health? What does that look like?
Yeah, so we've had a number of different clients, actually, interestingly enough, over the last month or two that have come with us. Now, I didn't even know doctors were actually monitoring this, but they're starting to monitor the thickness of the blood. So when they were getting their blood taken, their doctor actually noticed that, wow, your blood is really thick. Well, we call that ketchup blood, by the way, like sludge blood. So blood should be the consistency of like water, but most people, their blood is the consistency of like ketchup. It's thicker. And so when you hydrate the cells, that plays, cells are the foundation of the human body. You have trillions of cells. So when you make a cell hydrated and well, everything just functions better. And the blood will actually start to thin itself in a good way, right? Coming away from the thick, it makes everything pump easier. The blood's pumping. We also give people a cellular health exercise that we give people to do. So the calf muscles are actually a secondary heart in the cardiovascular system. So the heart pumps blood down. The calf muscles actually can be utilized to pump it back up. So that's another just, trick, if you will, that we could share on the show to get people to engage their calf muscles more when they're working out. And when it comes to the brain, so if a brain is just 10% dehydrated, you're actually going to lose half of the ability, the brain's capacity to actually connect with itself. So it's kind of like if I turn half the lights off in the room right now, it would be really hard to work in the room. And that's what people are experiencing. That's why so many of the times we have stress, anxiety, depression, we have a lot of mental challenges or even just mindset issues that people can actually reverse if they find the right methods of hydrating.
Well, and I immediately go to brain fog, and I work with a lot of entrepreneurs and executives. I'm a business consultant and I run multiple businesses, and I know that when I'm dehydrated, I don't make the best decision. It takes me longer to make decisions, and brain fog is a real thing. And one of the things we first talk about with, even in that, and I was in sports medicine forever with athletes as well, is brain fog means poor decisions, and poor decisions mean we don't meet our goals in life or on the sports pitch or in our business. And so it's so incredibly vital that we are set for success. And so before we break, you've talked about a lot of things, and I just want to kind of recap because it's important. If you're watching this at home, some simple things that you can do to improve your intracellular hydration. Add a pinch of salt to your water in the morning and the evening. Chelsea has shared that with us. Use your calf muscles more. We always used to talk about this, like post-operatively, doing ankle pumps. If you can't even be weight bearing, just getting that calf muscle moving helps pump your blood. So if you're sitting all day long at a desk, stand up and do some calf raises to get that blood pumping back up towards your heart. So those are two excellent steps that you already gave to everyone. And if they would like to reach out to you to learn a little bit more about this, Chelsea, like what can they do? How can they reach out? How can they learn more?
Yeah, sure. They can contact Energize. They can literally go to energizedhealth.com. So that's energized with a D, health.com. And we actually have additional learning material on the website, as well as a book, a free call with one of our or to get a free consultation. So we deal, again, from, it doesn't matter what someone's dealing with. If you make the cell well, the body's designed to actually heal itself. So, I really just would love to touch real quick too on the brain fog thing. So many of our patients that come through, their brain fog literally is gone within 3 to 4 weeks, because what I think a lot of people don't understand about the brain and the heart is they're electromagnetic organs. Mm-hmm. They function on electricity as well. So think about water and electricity. Water is a conductor for electricity. So when you're hydrating and you're doing it properly, the brain, like I said, all those lights start to turn back on, the brain's capacity to connect with itself. And so I just would love for people to be able to, learn more about that.
Fantastic. So we do have to take a brief break, but let's turn on all the lights in your brain room, getting ourselves fully hydrated at a cellular level. We will be right back after these messages. Welcome back to Vital Signs. We are here with Chelsea Jubilee talking about intracellular hydration and its impact on health. Before the break, we kind of touched on a lot of things. We touched on how we can eliminate brain fog with adequate hydration, how important it is for us to be fully hydrated for all of our body systems. But now, Chelsea, I think I want to get a little bit more direct, because I'm going to be frank. Christmas is around the corner, and we've all got those cute little black dresses for our parties and other things, and we're thinking about maybe I don't look so great in that, and I'm on some sort of a weight loss journey or weight management journey. How important is hydration and intracellular hydration in weight management?
Oh, great question. Well, first of all, I want to start by saying I would love for people to become educated on the difference between weight loss and fat loss. So most of us, we get on a typical scale, we'll stand on the scale and let's say it reads 200 pounds. Where we work so hard, a week later, it says 195. And we always like to challenge people, well, what 5 pounds did you lose? Because for most people, it's a lot of water and muscle weight that we lost first, not fat. And so the reason why intracellular hydration plays a vital role is because muscle is actually 75% hydration. 75%. Well, the more lean muscle mass that you have, the more fat you're going to burn. So a lot of the times people get stuck in their weight journeys. They yo-yo, they lose weight, they gain it back, lose weight, gain it back. Nothing they do is sustainable, but that's because they didn't really get to the root of the weight loss. So intracellular hydration, again, when everything is functioning as it should be, the body processes and gets rid of fat 10 times easier than it normally would, and you gain more lean skeletal muscle, which burns more fat.
Well, and I just want to kind of tie in something that we were talking about in the last segment in with this conversation, and that's, when we're fully hydrated, our blood is less thick. It's a little bit thinner, but it gives that capacity, and that's where all the toxin exchange happens. That's where we excrete waste. We filter things out through our blood. We bring and deliver nutrition through blood. So it's so vital that system is functioning highly, and we already talked about the benefits on the circulatory system, but kind of bring that into the weight conversation for us. So we've already talked about our lean tissue and being 75% water. Talk to us about how the enhancements in our circulatory system, all the other things, all the other benefits are actually helping us along our journey.
Yeah, so that's one of the things that we love to talk about is different ailments or even conditions that people have. So anywhere from migraine, headaches to digestive issues. most of the digestive issues that we get when people come to us, it's a super simple fix, which is just hydrating the digestive system. So if your digestive system isn't hydrated, you're not going to actually produce the necessary stomach acids to break certain foods down. Hence why, food allergies are off the charts right now with what's going on. I mean, we have so much education out there on health, and yet we're the sickest and most overweight we've ever been as a society. And the solution is weight loss drugs or injections, which all those do is just make your health go way down. That's like a whole nother show. But with that being said, it's just everything gets better. So we have a lot of patients with like neuropathy that we get because of diabetes or whatever they're going through. But if you can just think of it like a car, like jump starting a car, that's what happens to a pancreas. When you hydrate cells, everything just functions better inside of the organs. And when the blood, this is something else I wanted to touch on because I actually have these next to me. We talk about this a lot. So we were talking about weight loss, right? This, I know it looks like 10 pounds, but this is actually only 5 pounds of fat, 5 pounds. But what I want to show people now is 5 pounds of muscle. So do you see how drastic of a difference they are if you can picture like the difference of these on your body? And so that's why we don't like people to focus on weight loss. We want them to focus on fat loss because you actually could weigh the same and have an entirely different frame. We have clients that come in, they weigh 180, they go through our protocol, they weigh 180, but they go from a super overweight frame with a giant belly to lean muscle. And that's why we don't like people to focus on their weight. We want them to focus on fat loss.
And so talk to me about that. I'm a big fan about non-scale victories. I was in healthcare and sports medicine, and we see this in elite athletes. When they get injured, they want to stop eating because they're worried about what they look like. But as a result, the body holds on to more and lays fat and stores fat because it's going into starvation. There's a whole lot of other things that play there. But so we always have focused on non-scale victories. So share with us some of the things we can track other than just getting on that bioimpedance. Like what are some of the other things we can do or track so we know that we're moving in the right direction?
Yeah, so energy, I would say would be the first one. So the top 3 things that we hear all the time from our clients is my energy. I cannot believe how much energy I have, particularly in women. Hormones balancing naturally and sleep getting better. So sleep gets better in all of our clients, but for some reason, women tend to have a little bit more of an issue with that because of all the hormones that we have. And so that's another one. And then again, that brain fog lifting and going away. Now, the obvious ones are if you are struggling or dealing with an ailment like arthritis or pain, back pain, whatever it is, you're going to notice that you're not going to have the pain anymore. Joint pain, cartilage, all of that, hydration is required to get in between the joints. So again, that's like another show, but I do want to say those top 3 things are entirely noticeable very quickly. So energy, hence Energized Health, would be the first thing that people would notice immediately.
Fantastic. And I know you run some challenges. You have a lot of things going on so that if people are like, hey, I'm hearing this, I'm picking up what you're putting down right now. How can I get involved in this? How can I learn more? How can I get started on this so that I can see these results? I need less brain fog. I need to be able to sleep better. We talk about sleep a lot on this show. I'm looking for that energy. What are some of the ways that they can reach out to you? How can they get started? What does this look like?
Yeah, so energizedhealth.com would be the best. They can go to our website. On there, about 6 times a year, we do something called a 5-5-5 challenge. And what that is we actually challenge people to spend 1 hour a day with us for 5 days. And we guarantee they're going to lose 5 pounds of fat, not weight, fat. They're going to lose 5 pounds of fat, and it's $5 to join in on that challenge. So our clients love them. We talk a lot about the different types of sciences that we teach because we are focused on healing mind, body, and spirit. All those are really necessary to heal in order to have optimal health and not do the yo-yo thing like most Americans especially do. But yeah, so energizedhealth.com or my 555challenge.com would be either way to reach us.
Fantastic. And so we are drawing towards the end of our show, and I want to ask you, from your perspective, what do you really want our viewers to hear today so that they can get started? Because I'm a coach myself, and I'm a very big fan of what's the one small action I'm going to take today that's going to get me moving forward powerfully and improve my health, my peak performance, and I can start right now.
Yeah, right now I would say definitely get moving. Get moving. So if you're not working out, you're not walking, you're not doing any of that, get yourself up, get yourself moving. They've actually scientifically have proven that moving is the number one thing to actually determine your health outcome in the future. So I would say get moving. If you're not drinking at least 100 ounces of water a day, I would say please start drinking more water. Get away from the sugary drinks. Even just making those two changes and putting a little dash of salt in your water, along with getting moving, eating smaller portion size meals more times a day. Those are the top 3 things that we give people as tips.
Fantastic. Thank you. I'm a big fan of what do we do? How do we get moving? How do we get that forward momentum? Because let's be real, it's the one small change and that one small change that you do every day with consistency. And once you've got that, you put the next small change and pretty soon we've changed our habits and our behaviors. And then 6 months from now, we're loving our life and experiencing exactly what we want in our health. So today is the day, folks. Today is the day to take action. You heard it. Chelsea said it here. Get moving. If you're not moving, get your body moving. Let's start on our health journey. That's going to make you feel better. It's going to help you manage stress. You know, and then the other is have that little pinch of salt in your water in the morning. Let's make sure that we're getting that hydration. And I'm going to add another action step. Be sure that you reach out to Chelsea because this is a real area of opportunity. Almost everyone in America could benefit from what she has to offer. Chelsea, thank you so much for your time today and your expertise. I really appreciate you.
Oh, thank you so much, Jen.
And unfortunately, all good things do come to an end, including this show. But the good news is we will be here, same time, same station next week. Remember, get your hydration going, get your body moving, and we will see you next time. Have an amazing rest of your day.
This has been a Now Media Networks feature presentation. All rights reserved.